Hi, it's me again. This is actually video number 4 in my series about autoimmune disease, fibromyalgia, chronic fatigue, all that fun stuff. Um, I did forget to mention in video number 3 that I also take vitamin C every day. And that was prescribed by the eye doctor for the healing of the LASIK surgery. And I take 1,000 milligrams a day. And it was only supposed to be for 6 months, but I've been taking that for 9 months now because that's how far I am post LASIK surgery. I also wanted to mention some other medications that I've been on over the years. Like I said, I had the first symptoms of autoimmune disease when I was about 16 years old. And at that time, we did not go to the doctor for every little thing. We did not go to specialists. I don't even know what kind of specialists they had back in those days. That was back in the 70s because I'm 55. I just turned 55 in March. And so I've actually probably had autoimmune disease probably all my life. The symptoms I had as a teenager were the discoid lupus lesions, and I used to get them on my head. And there would be itchy sores, and at that time the doctor said just use medicated shampoo, so that's what I did, and it actually did clear up those sores. But those were the first symptoms of this disease that I had, and I didn't even realize the connection until just not too long ago. But I had continued to have those sores my entire life on my scalp. And I told you in video 1, about the bald spots it causes and all that kind of stuff. And the only place I've ever had those lesions is on my scalp and like behind my ears, like around my neck and stuff like that. But I haven't had them on any other part of my body except, for this dermatitis I have on my arms. But these are not lupus lesions. This is just a rash. If I could show you a lupus lesion, I would. I haven't had any for a while, but when they're there, they're extremely itchy, and they eventually turn in, to a sore with a scab because you scratch at them. Anyway, I wanted to tell you also some medications that I've tried that did not work for me. Okay, I used to have a wonderful PCP just down the street from me, but he left the practice, and he actually had prescribed this medication that it's called Savella, and I tried that, and just taking that for a few days, it made me so dizzy I couldn't even stand up. And I only took it, like I said, maybe 3 or 4 days at the max. And after I stopped taking it, I was still dizzy for like almost 2 weeks. So I could not tolerate Savella. It did not help me. It made me worse. And I have also tried Lyrica. And I believe it was Lyrica that did actually help with my fibromyalgia pain. But after the first 2 weeks, it did not help at all. So I'm not going to stay on an antidepressant medication that's not working for me. I've also been on Cymbalta. I've tried all of those antidepressants and all that, and none of them really worked for me. So, like I said, I don't want the side effects from antidepressant medications if it doesn't work. And when you're on those kind of medications, those 3, Cymbalta, Lyrica, Savella, if you're on those, when you get off of them, you have withdrawal symptoms. So, I mean, they affect your whole body. So I was thinking about, on my next visit to my doctor in June, maybe asking her about Lyrica or Cymbalta again. Maybe I could try it again. It might work if I try it again. I don't know. I have no idea. I've also been on lots of anti-inflammatories like Lodine, which is an anti-inflammatory you have to take like 5 or 6 at a time or something. It was like tons of pills, and it didn't work. So my old PCP from years and years ago because like I said, I wasn't diagnosed till I was like 32 or something like that with the fibromyalgia. And my initial diagnosis of that, they actually called it myositis. And then they said fibromyalgia. And at the same time, that's when I was also diagnosed with the IBS. And, oh, and I had actually had pleurisy, which is like fluid, you know, around your heart or somewhere in there. Anyway, I had pleurisy. I've also had bursitis in my elbow that lasted like 3 months, and that was very painful. It was like a big ball of fluid swelled up on my elbow, and it hurt so bad, and you couldn't hardly lift anything with that hand, that arm. And I went to the doctor, and they actually drained it, and then it would fill right back up. So I was going to the doctor every week, having that bursitis drained with a needle and a syringe, and it just kept filling back up. It was $100 every time I went, so I just started doing it myself. I'm actually a registered nurse, so I actually started doing that myself until it finally went away. I would just drain it myself in a mirror with a needle and a syringe, and because I actually know how to, you know, clean it with betadine and everything. So anyway, some other medications that I have tried. When I started going to the doctor I'm going to now, like I said, she's an internist, and she did all this blood work on me, and she is kind of like a pioneer in research and stuff with fibromyalgia and chronic fatigue syndrome. She also sees patients with HIV because that's also an immune disorder. But she had found that people with autoimmune have low glutathione, and I can't tell you what it is right now because I can't remember. I would have to look it up. I have, you know, all the paperwork on it, but anyway, so she has these injections. They're intramuscular injections that you have to do. I can't remember if they were once a day or once a week, but anyway, I was on those for 6 weeks, and here I was having my kids giving me these shots in the rear, you know, and trying to do them myself, and they did help with the glutathione level. They got it up to a normal level, but it didn't change any of my symptoms or anything. It didn't help me at all, so I'm not going to take those big old shots for nothing. And there's also something called ATP, and that level was low too, and luckily those are pills. She has these supplements called ATP supplements, you know, and of course I had to pay full price for all that kind of stuff because it was just like you don't get it at a pharmacy. She has it at her office. You get it from her, and it comes in a big bottle of pills, and I can't remember the dosages or anything, but I took actually like 3 bottles of those ATP pills and got that level up to where, you know, it was normal also. But again, my symptoms never changed. Nothing ever improved on me. So the only other medication that I have taken that I got good results with was Darvocet. And it's really, really weird. That's just a regular pain medication. And my old PCP had prescribed it to me, and it worked really well. I could go all day. I could take one in the morning, go all day, and function pretty normally, and then take one, you know, at night. And it took away a lot of my pain. I can't say all of it, but I would say it took away like 80% of the pain. And so I was just thrilled. And then guess what? They took it off the market before I could even get a refill. So I had 1 bottle of Darvocet, and that was probably, I'd say, maybe close to, whenever it went off the market. I can't remember if it's been 10 years or more like 8 or something like that. But it's been a long time. But that's the only medication that has ever actually really helped me. And of course you can't get it. They took it off the market because some people had heart attacks from it or something, but I'm sure it's people that abused it and probably took triple the dose they were supposed to be taking, and yeah, they probably had a heart attack. you know, probably even died from it. But so now people who actually need it and it actually helped can't get it. So I wanted to mention that before I went into anything about chronic fatigue syndrome.